My name is Tiffany Collins and I'm 14 years old. I was very surprised to hear that I was the 500th transplant at Stanford Children's Health. I've never thought of how many surgeries they do, and that's just heart transplants.
For me, the 500th heart transplant here at Stanford Children's Health is an incredibly important milestone. In terms of the past, it really says something about the legacy that has been built here over many, many years of excellence. I think for the present, it tells me and motivates me and the rest of this team, all of us, to continue to push hard far into the future so that we can help the next 500 children that need therapies like these.
Beginning of February, Mackenzie started to lose her appetite. The appetite got worse. Then she started vomiting, and we took her to our pediatrician, and they tested her for COVID, obviously, and it ended up coming back negative. We went back the following week because she had also developed a cough, and she would complain that she couldn't breathe. That second week, we did a chest x-ray, which came back clear. And then week 3, she started swelling in her feet. Run down to doctors on duty. They sent us straight to our local hospital. So within an hour, they said that she was in congestive heart failure, and they reached out to Stanford Children's, and within an hour, a cardiac ambulance was on their way down to us to pick her up. It was a huge shock to us. We had no history of heart disease in our family. She otherwise was a perfectly healthy teenager. It turns out that she has a gene that mutated and caused the dilated cardiomyopathy.
Her heart muscle was very stretched out and wasn't squeezing well. We used IV medications in the intensive care unit to try and help her heart function, but she continued to have progressive symptoms, and she started to develop some abnormal heart rhythms.
Mackenzie actually underwent 2 major operations with us. She had a durable ventricular assist device placed to help support her heart in the springtime, after which she was very well supported for a number of months before she ultimately underwent heart transplantation with removal of the ventricular assist device.
Dr. Ma opened her up and put the LVAD in, and that started the recovery for her. Stanford Children's Health has a reputation of excellence. There would be no other place I would go for either of my daughter's care. Today, you would never know that this child had 2 open heart surgeries in a 6-month time frame. She is swimming, we walk daily. Her energy level is pretty much back to 100%. She can do everything she did prior and probably better. We just didn't realize. For her to be such a success for Stanford's 500th transplant is just a miracle.
The Betty Irene Moore Heart Center transplant team is really remarkable in that we're one of the largest volume, both pediatric heart transplant and VAD programs in the country. And so what may be rare at other hospitals and even other specialized children's hospitals becomes more routine at our hospital because we deal with such complex cases on a regular basis. We have such a wonderful team who all contribute to the care of our patients. We all are able to work well together to provide the best care for our patients.
I am very grateful and thankful that they took such amazing care of me. It's amazing that I got my heart transplant so soon because I could get right back to doing all the things that I love.